start, and then if anyone misses the beginning, they can catch up on YouTube when this recording goes up there. So those of you out there who have not met me before, my name is Kevin. I will walk you through who I am in a lot more detail later on, because that's kind of the point of this entire presentation. I imagine many of you out there do know me because I've been at this university for a long time. I started my undergrad here in 2004, 2005, and have effectively never left. Did undergrad, honors, PhD, worked academically, worked professionally, and now here I am. So I have seen essentially everything that this university has to offer. And that actually puts me in a good position for this job, academic skills advisor, which I'm going to pull apart in exquisite detail in a second. And this is all framed around what we can do for you, whoever you are out there. Presumably, most of you are staff, whether you're professional or academic. I want to talk about how we, as a team, the puzzle piece, the little jigsaw piece puzzle, how it fits into the greater picture of the university. And as always, when I start, I like to acknowledge the lands that I'm on. So I am currently in the heart of darkness, right in the middle of the Italy building, the Learning Innovation building, in a little pod in this tiny little space, which if anyone else out there, I know there's at least, what, two Italy people in the audience there, have been in this slightly claustrophobic space. But where I'm situated, the actual lands that I'm on, I'm a teacher, an educator, a pedagogue. I like to always reflect on the fact that pretty much wherever I am in Australia, I'm on space where teaching, education, learning has happened for tens and tens of thousands of years, easily 60,000 years, if not longer. And it's a kind of teaching and education that often is invisible to scholarship sometimes. And we, particularly in the Western system, we often just sort of, not discount it, it's probably the wrong word, but because it's sort of like the wrong puzzle piece, to use the same metaphor as before, we neglect it. And so I like to always remind myself that like I am simply continuing a tradition of teaching that goes back well beyond when my particular ancestors arrived in this country. Now, what I am giving you is an overview of who I am, what I do, and what I can do for you, essentially, and particularly what I can do for students. So that's a whatever a four-dimension triangle is. I guess that's a square. Let's call it a pentagon because there's 5 points there on the slide. And yes, that's my name, my full name. I do prefer being labeled as Kevin Walter Jones because I'm actually Kevin Jones the third. So I use my middle name to differentiate myself from the other Kevin Joneses out there in my family. And my doctorate, I did do it here, as I described. I did it in Professor Elizabeth Aitken's lab. So if anyone knows Liz, I am one of her students from a while ago. And I did my doctorate in bananas, which is one of Liz's areas of specialty. So I have the most useful icebreaker in the world is that I can introduce myself to people as a banana doctor. It's not a joke, it's literal. Now, where I come from, and I know there's fellow colleagues in the audience right now, is Swiss, Student Support and Wellbeing Services. Now, if you've worked here a while, we were student services, and now we are Student Support and Wellbeing Services. So we've been rebranded, still the same thing, effectively. We live in Student Central at St. Lucia campus. So if you walk past the big building, it looks like an airport lounge. That is our home, but that's just the physical home. We are everywhere. I personally, I'm based at Hurston campus and Dutton Park campuses as well as St. Lucia. So we're across everything at UQ. And based on the name, as you can imagine, we do support and we do well-being. And there's a whole bunch of teams that operate in there, but we are looking just today at me, academic skills. We were previously called learning advisors, again, if you ever referred someone in that space. And I, unsurprisingly, feel very strongly and passionately about this space because I would also argue very strongly that student experience at university is contingent on academic skills, not intelligence, but it's these cognitive skills that you have that form the foundation that really determine, are you going to have a good or a bad time at university? And I have the joke there that we teach everything to everyone. It's barely a joke. So if I give you a list, and this is not an exhaustive list, but a list of like what academic skills look like, it's this: how to write, how to read, public speaking, how to write assignments, how to use generative AI, how to do exams, how to take notes. These skills, anyone who works in education, pedagogy at any level, will know that these skills are taught, to put it very politely, inconsistently. And when I say the sector, I just mean the university sector, and I mean globally, let alone even in Australia. There's a tendency, particularly at elite institutions, sandstone institutions, group of eight, the assumption is made that students, if they got into this place, they should know how to do these things. But I can tell you, and most of you know this from experience, that is not the case. In fact, I often find that the higher achieving students are, often the less good they are at academic skills because they've never had to actually build them. They've been relying on intellect or they've been relying on support at school. And so often this stuff fails. If you think Queensland commitment, we're bringing more like first in family, we're bringing more, lower socioeconomic background students in. Again, we can't just assume that people have these equal levels of academic skill. And those of you who've done program level curricula know that it's a nightmare trying to actually scaffold these skills across an entire program. Sometimes they're just not at all. Like I would ask those of you who work schools and faculties, like, how is public speaking scaffolded like across whole programs? Even in programs where, clinical communication, stuff like that, they're often not actually fully scaffolded. Sometimes these skills are just simply not taught at all. And this is something that's really, really relevant these days because those of you who've been grappling with secure assessment, if you're moving to like an interactive role assessment, so other forms of like assessment that involves talking out loud, if we haven't been training people in public speaking, they're going to struggle immensely with these new kinds of assessment. So my job, gap filler or spec filler is the slightly less polite way of putting it, as in when you have these cracks in these academic skills, we can fill them. So who we are, we're all, anyone knows the term third space practitioner, we are all archetypal third space. So people who don't know that term, that's whole university is divided into the professionals and the academics, the two streams. Third space are people who straddle both boundaries. A lot of jobs like that. Italy, just building them in right now, Italy's full of third space practitioners. If there's any librarians in the audience, the library is full of third space. We're in this weird position where we don't quite fit into either academic or professional. As I mentioned earlier, like I've worked in both spaces. In this current role, I do both. And I teach everywhere. I teach individual students, which I'll talk about in a second, but I also teach into courses everywhere, schools, faculties, institutes, undergrads, HDR, any student of the 55,000 in this university, they can come and see me. We have a whole bunch of different backgrounds. As I mentioned, I'm a banana doctor, but there's a couple of people on the team. We have a physicist, we have people who have like applied linguistics, we have a vet on the team. We're not specialists though. I see all students. So I might have a student who comes and talks to me about, biology, my background, or one who comes and talks to me about like signs and semiotics and, 20th century French philosophers. And I just have to know about this stuff, which by the way, that is one of the greatest side benefits of my job is I get to engage with basically every academic discipline in existence, which means I am a reservoir of, I was going to say useless jargon and trivia. It's not useless, but as in like well beyond the sciences and biology where I came from. Now, what we actually do, that was your philosophical introduction to our team. Three things. There are three categories, three core components of my job. Primary component, which takes up probably 50% of my time. Any student in this university can book one-on-one, like a doctor's appointment, a dental appointment, 30, 60 minutes. And they come in and ostensibly it's to talk about academic skills. And I've given you 4 examples of what that looks like. A huge proportion of what I see are med students. They come and see me. Maybe they're struggling hugely. They failed, but they could also just be like, well, I want to study better. I want to have a life. I want to actually study more efficiently. We get pips. I see a lot of engineering pips. So first year students who went in a bit overconfident perhaps, then failed everything and then need support, help in building up study skills. I get a lot of HDR, which if there's any HDR supervisors, advisors out there, like the most common question I get is, what the hell is a literature review? How do I write a literature review? Anything. Students can ask about any of this stuff, and my job is to walk them through it, teach them. Maybe I can do that in one session with a bit of advice, sometimes multiple sessions. Ostensibly, this is about academic skills, but frankly, it starts to bleed more into kind of holistic support, as in students will come to us, ask these questions, and then we can actually go talk about broader supports in the university, for example. And I'm bringing that up because we're often a good first starting point for students to enter into the broader UQ support ecosystem. I'm going to expand more on the one-on-ones because that's something all of you, particularly those of you who are in teaching roles, if you've got a student who comes to you and they're like, I don't know how to take notes in this course. I don't know how to study. Like that is our domain. You can essentially sort of pick that student up and drop them into our space, and that is what we will teach them. So you're obviously welcome to do it yourself, but like if you don't have the time or you don't feel comfortable doing it, like you can immediately give the students to us. We also run generic workshops. So orientation next week, I'll be doing your classic like referencing well and avoiding plagiarism, how to 10 steps to a better assignment, these sort of classic core workshops. These are, we know from research that they're not super effective. Like students who are motivated will engage them, get stuff out of them. What's much more useful, and we know this from research, are what are called embedded workshops. And so that's where I might do something like referencing and avoiding plagiarism, but I get pulled into a course coordinator's course and we customize the workshop based on the course. So right now, every semester, I am embedded in a first year, first semester postgrad public health course, the Foundations of Public Health out at Hurston. And so I do 3 workshops that are tagged to the assessment in the course. We know that when students contextualize the advice based on what they're doing as assessment, they absorb the learning orders of magnitude better. I bring this up to plant an idea in your head, which is if you were thinking about doing that. So, a classic thing I get as an academic comes to me and they're like, oh God, everyone is failing this assessment or everyone's failing this exam. Like, what do I do about this? We can be summoned in to do a workshop. Sometimes, like, at short notice. I've had academics where they've had like everyone's failed the mid-semester exam and they're like, oh God, can we do like an exam workshop? And then we just do it in like 1 or 2 weeks. Ideally, it's planned out over time, but like if you're interested in this, I'll give you contact details at the end. You can talk to us and pitch it as an idea. One thing we really want to reinforce though is that everything we do, we are more than remedial. So I think one of the views that kind of like happens in this space is people think of us as students who fail, students who are on PIPs, students who are on academic warnings, they go get help from the academic skills advisors slash learning advisors. That's true. We absolutely do this. And that is a great part of our job. But we also see high achieving students. I see students who get straight sevens all the way through. I see a lot of like, I work with the elite athlete cohort. And as I said, I see millions of med students. Well, PIP, by the way, is a progression improvement plan. So a student who if you fail more than half of your courses in a semester or get less than, I think it's like your actual average GPA is less than 4, there's 2 like states for this, you get a warning. And then if you do that again, the next semester you get a PIP. And often part of a PIP is you are obligated to come and see us. So the ADAs, I think it's the faculty ADAs who make this decision, although this changes every semester, so I often lose track of it. Uh, it's a requirement to come and see us. But if you get a student who's on an academic warning, or you see a student is like failing stuff, getting them into our support ecosystem earlier than a PIP is better for literally everyone. It also saves a lot of paperwork down the line. But yeah, I want to stress like we do that, but again, we see everyone. It doesn't have to be a student who is struggling, it doesn't have to be a student who is failing. Again, what we do is more kind of like mentoring than it is you have a problem and we're going to fix that problem. So, how you can use everything I'm telling you, there's stuff on our website. If you want to actually embed what we do into like, if you've got a course site, if you're a coordinator, for example, you can embed, like I've just given you an example there of our planners, the glorious semester planner, which we print out and hand out in person now. Students absolutely love these wall planners. We give them out all the time. We do slowly expand the content we put up online. Eventually, like I want to get YouTube videos for like 15-minute summaries of all academic skills up. That's aspirational at the moment because I need time to do that. But keep an eye on our links there, our website. There is stuff that goes up there. Keep an eye on our workshops. So if you're not familiar with the generic workshops that we deliver, it's worth going and checking them out and then referring students to them. We mostly do these at the beginning of semester, but like if you've got a student who's returning after study, it's a very good idea for them to like do these workshops. Another classic, I'm going to use another acronym, MARS, mature age and returning students. Uh, they are really good candidates for this kind of stuff because people who've like maybe gone and worked for 20 years and then come back to university, building up academic skills, like often those skills have wasted away to nothing. So that's what happens if you don't use them. These are a really good refresher of getting back into university. We do a couple of multi-session programs. I've been getting more involved in the last couple of years in the neurodivergent space. So ADHD coaching, for example, is a happens for all 13 weeks a semester actually session that I help run. You've got First Steps in Research, which is targeted towards honors students, some like study sessions that are specifically for humanities and writing and specifically for science and STEM. Peer writing, which any veterans here might remember peer writing from before COVID. which kind of died off again. It's coming back. So peer writing is a program where mentors students. Student can just bring a bit of writing to them and slap it down in front of them and ask for advice. We're really going to push peer writing this year because our kind of advertising push for it is, okay, if you're using generative AI to write, great, okay, fine. That's part of like the whole secure assessment model, but consider getting a human being to look at it. Because if you can get best of both worlds, a generative AI input and a human being input as well, like win-win. And the thing about linking in the chat, I will do that at the very end. It's also the links are in these slides. Big thing for you, we don't have a referral form. It's something we want to get in the future, but we don't have one yet. It could be useful if you're sitting with a student and you want to actually get them into our ecosystem, as I described. Sit with them and actually book an appointment with them. So they book through Student Hub. They book the same way again. You'd book appointment with the dentist. They just go in there, find an available slot. Although if you went in there right now, there are no available slots because we are booked out at the moment. But go in there and book it. Because again, as I said before, once a student is in the system, they will tend to persist in there. It's just getting over that initiation energy. It's like every, behavioral change thing. Getting them into it, then they're good. And worst case scenario, send them to, well, I shouldn't say worst case scenario. The default is to send them to Student Central. Like one of the rules with support in this university is it can be quite overwhelming and confusing trying to work out who to even talk to. Student Central, Student Central, Student Central, even if they are off campus, let's get them to contact Student Central. That is the nexus. That is the hub. They will get into what they need from there. So next steps for you. So I'm going to wrap this up now, 20 minutes out. And then if there's any questions, I can take questions. What we always like is normalization of our services, particularly from student-facing staff, particularly academics. So especially if you're a teaching academic, a course coordinator, etc. Anytime you can talk about our services in a way that normalizes them, that this is something that's perfectly like, it's not just a deficit. It's not just, oh, there's something wrong with you. You need to go to the people who fix the thing that's wrong with you. It's just, this is a source of advice, a source of mentorship that you can access in the university. Do it. And we know that this coming from academics, particularly academics that students know and trust, like this message has much, much more cut through. And so that's one thing I ask you to do, but this is win-win for everyone, which is like if you get students into these services, it makes your life more easy because then you don't have to do the remedial work when students do fail. And so if you can promote this anywhere, like if you are doing orientation next week, any of the program, if you're doing course level orientation, the first week of semester, even on Blackboard, if people are asking questions on discussions boards, etc., just be like, have you considered making an appointment with an academic skills advisor? Have you looked at Swiss's resources? This is very much, what do you call it, like a network effect as well as a word of mouth. Is that when students engage with these services and they find them useful, they tell other students, and then that spreads like a virus throughout the student population. That's probably a terrible way of finishing this presentation, but what I will actually finish on, call to action, always a good way to finish a presentation with is a specific call to action that you want the audience to do because it sticks in their head. If you are a teaching academic, you don't have to be a course coordinator, by the way. Like if you're a casual academic, if you're an academic teaching into a course, for example, you can pitch this to the course coordinator. If you've got an idea for an embedding workshop, so like I do embedded, I've done all sorts of embeddeds over the years, any assignment-based ones, genre-based ones, but I do, group work, how to set up a group so it functions, ideally. I'm doing more and more public speaking ones, and I do fully expect that the next year or two, there's going to be a lot more demand for public speaking support with secure assessment, interactive role assessments, those sorts of things. But I am open, and when I say I'm referring to Royal me, our team, open to pitches. So like all that will happen is if you contact me and say, hey, I've got an idea for an embedded workshop, we will give you an honest appraisal back. Like, yeah, sure, that sounds like something we could run straight away. Actually, we'll need time for that, or this is probably a next semester, next year thing. So there isn't like a formal process for requesting these. It's just case by case. And I leave you with that. Embedding. I'll copy paste my email into the chat in a second. And I also am contractually obligated to promote the rest of Ready to Teach Week, which I will stress, by the way, particularly if you are teaching focus, library, 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 library. So how the library supports your students, for example, would very strongly recommend going to that because two kind of pillars, there's multiple pillars of student support in this university, but the two kind of big direct student support, library Swiss, and they're both complementary and sometimes confusing. It's sometimes not super obvious. Sometimes like uh, what's if you're a student, like who do I talk to? Just remember, the message always is to tell students to talk to someone. Because like if a student talks to me and I'm like, that's actually a library thing, I can point them to who's the best person to talk to in the library and vice versa. So that's my number one key message is just like anything you can do to, I was going to say trick, to convince, to persuade a student just to get in, do it. Now, while stuff has been posted in the chat, two things. One, any questions? Or to do the classic, um, what questions do you have for me? Rather than saying any questions, because it creates less of a psychological barrier. I'm just going to. That is an excellent question about do I have a promotional slide? I do not. That is something I've been trying to get for a while now. I'll see. That's my email, by the way. Oh, yeah, good. So the question about what can I do for students who are already achieving good grades. So this is a really common thing I get from med students where like they're doing well, doing very well actually in some cases, but they're studying, 12 hours a day. And so it's sort of eating away at them psychologically, emotionally. And they're like, well, can I do something about this? And so what we'll do is we'll sit down and talk about like, all right, you're doing good study, you're doing effective study, but are you doing efficient study? And so then it's like doing an inventory. Walk me through exactly everything that you're doing, and you're a med student, you're doing a lot. We're going to look at could you be getting an equivalent amount of yield for this study activity by doing this rather than this, and it will take you half the time. So if anyone's ever seen me talk in orientations and sessions like that, you'll hear me talk about factual learning versus conceptual learning. 2 hours of factual learning might be worth half an hour of conceptual learning. So if you can substitute one of these activities for another activity, you might end up studying for 8 hours rather than 12 hours. And that's the difference between burning out. So you're still getting sevens, but burning out or even literally having like a mental health episode 1 or 2 years into your study. When I work with elite athletes, often they just literally do not have the time to study. Like the ones who are rowers, they have to get up and study like 7 hours, or get up and train like 5 hours in the morning, come into their lectures and just immediately pass out from exhaustion because they're that tired. And so they get like an hour in the evening to work. So it's then, all right, how do I make absolute maximum yield of that 1 hour? And so again, we go through and look at what are the actual modalities of study you can be engaging in? What's the most effective and most efficient? And this is this thing where like I can't just give a student a list of like, do this. It has to be contextualized to what they're studying, their mindset, all these sorts of things, which is why that's always best done in a consult. Question about do I have a library of videos? No. And that's apart from my vaguely viral Instagram post on the UQ Life thing about goblin tools, this is on the cards to make this. I just haven't done it yet. I actually have a long-term plan to try and get uh, academic skills advice at like in 1 minute interval, 15-minute interval, half an hour, as in like ever increasing, like a TikTok for 1 minute, here's some advice. YouTube video for 15 minutes, here's some advice. A 60-minute workshop, here's some advice. All right, what's Goblin Tools? That is a generative AI that is neurodivergent friendly. So it's something I recommend strongly to a lot of particularly autistic and ADHD students. It's got its pros and cons, ups and downs, like all generative AIs, but it's not a bad thing for things like task initiation, which a lot of students really struggle with. They're fine once they start, but getting over that initial like blank page shame, good way of doing it. And how many in our team? We are actually currently down someone, so we are 3.6 FTE, which is like 1 to 17,000 students, I think. It's not a lot, and it's one of the lower ones in the country, like university wide. We have one of the lowest ratios. So busy, overworked. Yes, I won't say overworked, but definitely busy. And yeah, like I know probably nine out of 10 med students who want to see me never actually get to see me. And yeah, it can be very hard to get an appointment, which is why, which I will stress, by the way, if you've got, do you all know about welfare checks that you can do like, so not in our space, but in like counseling, you can submit a welfare check on a student's behalf so that someone will check on the student. If you've got a student that you think is in like real crisis and you think that like them getting our advice would be useful, you can contact Swiss and just say, look, I've got this student, can you, because we do have some capacity to like shuffle things around. We don't fully have like triage appointments, but we can create triage appointments. So like, again, if you've got a student you're very worried about, like get in touch with us. And yeah, if you think there needs to be more of us, advocate, please. Like we could easily have 10 times the number of staff and still have like be booked out. But that's something why I'm really focused on how can we build more like YouTube videos because then that transcends consults. But this is getting into Kevin's APD territory now. So I can also just very, very, very quickly, in the last 2 minutes, sorry, I just have to close the actual PowerPoint to do this. I'm just going to
While you're doing that, Kevin, I might just put up a quick poll for everybody, and
go for
they'll
it.
be able to listen in to the conclusion of your session and also fill in a poll at the same time. Only two questions, everybody. Takes about 20 seconds. Should be on your screen now.
And I've just added the slides to um can I rank myself?
Absolutely. You won't be the first.
Right, a nice little reflective thing about my deep self-loathing. Anyway, I put the slides in the chat because all the links, there's links embedded in there if you want to grab them. And yeah, as I said, same with students. If you refer students on, like if you don't know, just talk to me. Just grab me in the street. I'm very easy to identify. All right, I'm off to, funnily enough, do an embedded work, a 2.5 hour embedded workshop for Queensland commitment students in half an hour. So I've got 2.5 hours of lecturing straight after this. Any questions for the last 30 seconds? All right. Have a nice afternoon, everybody. Thank you, Italy comrades, for assistance.